We're going to go ahead and get started because we're right at our magical time. So
okay,
we've got about half of our registrants on right now. So we'll probably see this number keep going up. So hopefully we'll get them caught up if they come in late. But I'm Tiphany Lopez. You guys probably know that. I work for Aesthetic Record, and we've been doing this webinar series now, I feel like for 6 weeks, maybe less. I don't even know at this point. But we have a phenomenal guest today who I happen to just personally adore. I met Heather a few years ago through Galderma and some training things that she was doing, and has had a great reputation for being a phenomenal salesperson. Has been doing a lot of national speaking. He had a big event at AmSpa. You've been doing lots of webinars too. So you've been getting around too, sister. I know you've been everywhere as well.
I'm having some fun, but I have to say, I throw it all back to you. You saw something in me when I was doing that, and you needed a speaker, and I jumped in, and it's just been uphill from there. So again, I always tell you your goals for me, Tiphany, and I'm always thankful for the opportunity. I'm certainly passionate about what I do, and I love to share. So I'm hoping I can give some insight today and some pearls and get everybody excited to get back in and do this, because it's going to be like hit the ground running, ground zero, like brand new start, new attitude. And I, for one, I'm excited.
It's almost like Christmas morning all over again. You know, like we're waiting for Santa to bring our presents. It's kind of what I feel like right now. So a lot of anticipation, but when we talked about doing a sales focused webinar, you were the only person I thought of, period. You were it for me. So we're glad you're here. But for those of you who are just joining in, we have Heather Rypien. Did I say it right?
You did.
Man, I'm getting good. Who is located in Manhattan, where she practices in Manhattan, but she lives in North Carolina, with Dr. Steve Pearlman at Pearlman Plastic Surgery in Manhattan, which has been hit so hard. You guys have had a rough go. So you'll be coming back a little bit later on, but you've been using this time to do a lot, both as a company and a group, but also personally to educate across the country. So I know you have valuable things to discuss with us today, and I can't wait to get started. But to give people a little bit of an overview about you. So obviously we put this on here about your current job, but on your side gig, you're a gain trainer, part of the Gen Now faculty. So you're going to be a big part of the KISS launch, I'm guessing.
So excited. Yes, I am.
And I think you went to Sweden, didn't you? You got to play with it in Sweden.
I did. And we're working on a video to put up for Dr. Pearlman and the Pearlman team. Like I said, I feel like I got a little bit of a jump start because I got my hands on it a little bit early, and we do a lot of lips. And so that's going to be a big thing. Of course, we'll probably touch on that later in this discussion, but I think it's going to be a game changer for us. And I feel like blessed that I got to be part of that experience.
Well, and last year at Aesthetic Next, you were our right-hand woman all weekend long, helping with all of our injections. You'll be, again, this year coming back to Aesthetic Next, also speaking on a few topics. So sharing with us more insights. You're licensed across like every state in America, so you're always somewhere training.
Yeah, and 26.
That's crazy. So if you guys want a good trainer, and Dr. Pearlman will let her go for a day, she's your girl. So he may be saying, no, she has to inject to catch up on all the backlog for a while. So.
Yeah, I anticipate us being really busy getting going. That's my hope.
All right. Well, someone says the page is blank. They can't see any slides. If you are out there and you can see my slideshow, will you give me a Q&A, a chat, anything? Can you see it, Heather?
I can see it.
Okay, perfect. So we do have some who can see it. All right, well, we're going to do like a little bit more of a Q&A this time, more probably than normal, because I just want to pick Heather's brain because she knows so much. And I put this picture on here with this person full on PPE, because I think your average injection patient comes into the medical spa or the surgery clinic or the dermatology clinic looking for their beautiful, wonderful injector, and they're going to see this person instead. So I want you to talk us through how we still connect and make a patient interaction and engagement with all this stuff happening around us.
Okay, so I have a little bit of a different perspective. I got into nursing as a second career. I was a flight attendant, so I have a very strong customer service background. And even going across the country, I used to like joke, you get to know people so well. Like on the West Coast, someone would say, I want my coffee regular. Well, you know, that's black. East Coast, it's cream and sugar. It's the same thing. And when your patients come in prior to this and you get to see their face and you pick up on their body language, I've always been a firm believer that you have those few moments, even in the basic introduction. People want to be excited I like to go out and say, hi, I'm Heather. It's nice to meet you. Thank you for choosing us. Like, come back and you're like, thank you for choosing us, but it is a choice. And you get that minute. And so when you're walking back, I'm not a big, I want to take your photo first, because I don't want people to feel pressure. So we'll go back and have some commonality, and I'll be like, oh, are you from New York? A lot of people aren't. And I do have a little bit of a jump start on that because I've lived all over the country, and I use that opportunity to try and find some commonality. Like, oh, do you have kids? Do you whatever? Just to strike a conversation up that gets them comfortable. They're already in a setting that's a medical field. A lot of them are nervous. A lot of them want their fears calm. They want to have that personal connection. And I think post-COVID, it's going to be a little bit difficult. I know as providers, we're going to be using PPE. Our patients will have masks, but it's unrealistic to think they're going to have their masks on the whole time. Like, we need to do a patient assessment. We need to do whatever. So I think body, playing and just making that comment is like, you know what, I'm a hugger, days of handshaking are gone, but I'm giving you a virtual something, just something to break the ice, because I think it is going to be really uncomfortable and people are going to be really apprehensive. And I think walking through the door, how prepared the staff is going to kind of set the tone for that visit. Do you have sanitation wipes? Is everything, because before this happened, I had a patient say, I feel more comfortable because I left New York right before this happened. Like, this was just breaking. And I'd have a patient meeting, like, we're just like, are you nervous about this virus? Like, what's going to happen? And they're like, I feel more comfortable in a medical environment than anywhere. So I do think we have a little bit of an advantage that people are going to have a sense of safety being in a medical office. But I think it's going to be very much approach of when they walk through that door to try and make that a personalized experience for them.
I agree with you. I think that as I look even in my own state and having traveled some during this crisis, I think about going to Walmart or Home Depot are far more dangerous for me than going to see you to get my lips injected. And I may be totally off base with that, but I feel like at base level, a medical facility tends to be more clean than Walmart, we hope. You guys are already at base level doing all these things that I think, to your point, when patients see it, hopefully it will instill trust.
Exactly.
And not be like a scary thing. Like, look at all we're doing to keep you safe, or as best we can to keep you safe. Versus if you're going to go to the local Home Depot to pick up some materials, you're far more at risk, most likely, than you are in our facility.
Yeah. And I think that, like, for me, another thing that I plan on doing too is I'm a big, obviously as a healthcare provider, we're about big, like, hand washers, but we have sinks in all of our rooms. I'm going to make sure, because, I'll have my equipment on, but I'm going to be extra vigilant about making sure I'm going to say, okay, hang on a second, let me wash my hands and clean gloves. If I have to, I'm actually going to say, just let me clean my gloves, can't be too safe. I want them to actually be part of seeing that we're taking part of that, not just, oh, you're wearing a mask. I want them to think, okay, they're taking every precaution. I'm seeing her wash her hands. I'm seeing her change her gloves. And that's something like I always did. And people, you come back from the waiting room, your hands are clean or whatever, but I think now people are going to be more in tune and paying attention to watching everything you're doing. They're going to want to see stuff opened up. They're going to want to see clean. And so I know personally, I'm going to make a point of making sure that my hands are being washed while the patient's in the room when they leave. Just anything to give them a sense of security, because I think everybody's going to be apprehensive. Although maybe not so much, because they're all so excited right now that I think they would come in even if we weren't wearing a mask. The feedback that I get on Instagram is like, please, put me on a slot. I mean, they want to come in, they want to get going.
They'll do it in the parking lot. Just get my lips done. We'll do it in the parking lot.
I've actually had patients say, are you doing home visits? I'm like, no, we're not.
No, that's maybe a little more risky. Well, I think you make a great point about, and I think as we transition to this next part, that when you're talking to patients, if you're taking the time to do all the things in front of them, that gives you a tremendous amount of time to chit chat and talk and catch up without losing time. Because my fear for all of you is, as we add all these new steps in, how much does that cut into your traditional talking, consulting time that you need to be able to turn a profit and make revenue, make profit despite having all these extra steps? So, like, what is your plan going to look like when someone walks down the hallway and gets seated in your chair in your room?
Well, I think time management, New York City has definitely made me up my game a little bit because I'm Southern and slow and bless your heart and how are the kids. And I learned, when I started with Dr. Pearlman, it was a little slower because Dr. Pearlman was a one-man show. He did all of his own injectables and he did his consults so this was a new addition to our practice. And it took me it was a tough year to try and learn to hang with these guys. I mean, it's a tough crowd, but I kind of get the flow. Is like, I don't waste time. I'm constantly doing something. Like, you need to have eye contact and engage with them and stuff, but like washing your hands and taking that time, it's going to be interesting to me. I think the conversations are going to change a little bit. I think that people, first of all, they've had way too much time on their hand. They've fixated staring in the mirror. A lot of people have given up on wearing makeup. They're like, oh, my nails, my hands. I think they're going to be overwhelmed with everything. But a lot of times people come in, and I think that's a big thing with patient retention, is everyone has a story. They're coming in for a reason. I have patients sit in my chair that they're like, you know what, my husband had an affair with a girl 20 years younger than me. All of a sudden, my spouse passed away. Or I've been out of work for 5 years and I have to re-enter the workforce. I need to that. Or I had a patient tell me one of my favorite stories. She's like, I just had to run in to see you because my daughter asked me today, like, Mom, why do you have bacon on your forehead? There's a reason she had all these lines and her daughter called it bacon. People come in for a reason. Very rarely, like, you'll get those, ooh, I have this line. But that's where I think you get the potential to build that relationship and be like, let's get to the root of the problem. How are we going to make you feel better? And I think everybody's going to have some kind of underlying trauma or stress or, and I make a joke all the time now. I'm kind of like, divorce attorneys right now are going to be killing it when they can open. I mean, everybody's been locked up with their spouse. They're just going to want to get out and feel better, or their spouses are finally going to be like, what's wrong with you? And they're like, duh, you never told me I could get Botox. You tell me not to, but let's just be real. I do it. And now you see what I look like when I don't. So I think it's going to be a whole different conversation that we're going to have with our patients, which is going to provide opportunity. And I think this is going to be a great opportunity to have long lasting relationships, if that makes sense.
I think you said the word feel several times. And I think that's the difference in right now. So we think about that a lot. Like, I want to connect with you as a person, what motivates you in sales. That's how we all work in sales. But I think right now, to think about the person with the PPE on in the prior slide, if you're coming into that, talking about the way they feel is even more important, because now you have to kind of cut through the barrier of all this like medical sciencey stuff and connect even more. So I think those people who don't traditionally want to be the kissing babies, holding hands, talking about their feelings with patients, I think now you're going to have to do it, because you're going to have to find that vulnerable human piece.
I agree. And there's always a reason someone's coming in, but I think people are going to be, first of all, they've been locked up with no one to talk to. So we're going to be like hairdressers and bartenders. I mean, people are just going to be so excited for the limited human contact that they have. I think we're going to get to know our patients on a different level, which is going to open up so many opportunities to have them in our practice for so many modalities that maybe they weren't aware of that they had. And like I said, I know in our slide deck, it goes on, we'll get into it a little bit more, but I think we're going to have a unique opportunity here. I think, and it's unfortunate, and I'm sure Tiphany, you're very well connected in the industry. There are a lot of small businesses that unfortunately aren't going to make it, so we're going to have a different patient demographic coming in. We're going to have, I think it's going to be, booming. And like we talked about the other day, there might be like a little lull, but I think we have an opportunity to build long lasting relationships and coming up with treatment plans than maybe we had before.
I think that's another great point too. We're going to see, and even I'm seeing it from our customers and things happening on our end, folks going out of business, and they're going to have patients now who are out in the wild looking for a new home, who come to you, who aren't used to your normal experience. They don't know how they're normally going to be treated if they were to come to you in a non-COVID world. Now trying to assimilate into your practice, into your protocol, into your mindset. I think that's going to be a bit of a challenge for many, because typically if I come to you, you're going to dazzle me with your experience. I know you will. They're not going to get the full Monty that they normally would, and they're new to you. So it's like, how do we connect that back to what we know to be our everyday experience despite all this other chaos? So we're going to have to work a whole lot harder on that.
And I think we're going to have to work a whole lot harder, but I know like in our practice, I take pride and I think we have a really strong team. And I think from the minute you get, you know, you talk to someone on the phone, I think consistency is it. But I also think that there are a lot of people, I think everybody's going to be on a budget, but I think it's going to be a new opportunity for people who are used to going in, because a lot of places, and I think that's really important for everyone to understand, is an experience. You can go and you can get your neurotoxin, your dermal filler anywhere. But when you walk in, it's like everybody cuts your hair and you're like, oh my, it's the most amazing haircut ever. Well, your hairdresser moves away and you go to someone else and you're like, oh my God, this is better than it was before. You know, and oh, I get a glass of wine while I'm getting it done. Or, you know, you're like, try this. I think it's going to be a good opportunity to capture those new patients that maybe didn't have that experience before. So I think that's why I was excited to do this webinar too, is I think we're going to be our own success or our own demise. The opportunity is going to be there for every one of us. It's how we take advantage and we utilize that opportunity.
Preach, sister. You're preaching to the choir over here. So I've got a question for you, thinking about all these protocols. I know that you do a really in-depth consultation. So how do you feel about things going virtual and doing some of your consults online or in a virtual format?
I'm kind of on the fence about it. I've had some patients text me and say, hey, Heather, what do you think? And I'm willing to have the conversation with them. I don't know, like, I know Dr. Pearlman has been doing virtual consults, and with surgical, his surgical eye, he can get an idea. There's nothing like sitting in the chair, but you can at least build credibility. This is what I can do for you. Of course, it's going to be better if I can see you. For me, the consults that I've gotten request virtual have been like lip consults. So I think I would rather utilize that time, because I think we're going to have to be really time conscious when we go back, to give a general education standpoint of this is what's typical. I can tell you from looking at you, I think you would benefit from this. Of course, I'd really want to see you because you want to see a repose, you want to see an animation, you want to really get a good idea. But like for me with dermal filler, it's a little bit different than having like your surgical consults. And there's some that I'm like, you know, you need surgery, you know, and that's why I love in our office. It's like, we can do this so much, but for your end result, you know, you're going to need surgery. But with dermal fillers and like neurotoxins, I think the toughest challenge as providers that we have is the expectation, because a lot of places will say, you know, you have your results that last up to a year. Okay, so what does that year mean? Yes, you're still going to have some product on board, but is your result going to be optimal? Is it going to be what it was 8 weeks out? And then people will be quick to say, and I hate it, I would never, ever undermine another injector. I like to say everybody has their different approach, but I'm not going to set an expectation for a patient that I have to apologize. I'd rather say, you know what, your lips are probably going to last 6 months and then we can top it off. So I think virtual consults are great to have that conversation as far as product choices and longevity and what to expect and what the experience will be like. I don't think it's going to ever replace a complete face-to-face. They may say, okay, I'm on board, and get them in and say, okay, we discussed this. This is probably the best product for you. And I think we'll be able to do a treatment that day because you've gotten all the paperwork and the education component out of the way. So I love them, as long as you're not promising you're going to come in and I'm going to use this product and this is how we're going to do it. Because when they come in, a lot of stuff changes between then. And you may just in that moment, I've had a patient say, and I'll be like, you know what? I just changed my mind. I don't think that's the best choice for you. So being careful what you promise. I think virtuals are great as a guide, but like not a Bible, this is not the way this is going to happen. I'm not going to deviate once I meet you. If that makes sense.
It makes total sense. I think about them in the sense of like, I hate to use the word tire kicker, but I'm also Southern, and we say, we're out here just kicking the tires. You're a tire kicker. I think for those people that are going to clog up your schedule and going to potentially waste your time and say no, or not today, I'll come back next week when the schedule is completely full already. I think in that regard, it's a great way to kind of cut through the BS. But to your point,
exactly.
You don't know. I can't tell how thick, you know, there's so many things you don't know virtually, but I think it's a great way for those of you thinking about maximizing your schedule time. If it's a free consultation that you've never seen the patient before, they're not inclined to buy right then, virtual can save you a lot of cleaning and the things we're having to do. So
Exactly.
An option.
And a lot of times one of the sales tools that I use, and I hate to use the word sales, but if I have a patient that I have just spent sitting in my chair for 30 minutes talking, sometimes I'll have to say, you know what, we've gone all over this because they're the ones that have all the questions and they're the ones that need all your time. You know, we've utilized your time today for a consult. Let's get you in the book and we'll come back and now we have a plan. I'm not going to rush through someone who has all these questions. And I've also been in the chair, they're like, well, I'm just trying to decide, like, I don't know. And I'm like, then don't do it. I really love the no pressure approach to sales, because I will tell you, they will usually say, you know what, I decided you're my girl. I'm going to do it.
Mhm.
Or I'll go, you know what, go get another consult. It's your face. You have a choice. You need to go where you're comfortable in that chair. And they'll go, you know, I just decided it's you. People don't want to be pressured. They don't. If you are confident and you're excited, you're like, I think I can do this for you, and you're honest, you're 8 out of 10 times you're going to get their business and they're not going to go anywhere else.
Yeah, if you tell that, you're like, no, don't walk away. Just do it. Because I
Yeah,
want to come and get something when I'm there.
Yeah, and usually they do. And that's the opportunity to do it. It's just, you got to be careful, because if they've been 9 places and 8 people have done it wrong, chances are you're going to be number 9. So it's really important to be a good listener, because none of us want to have to go clean up messes and apologize and you know, utilize your time to do, because you can usually get a good sense if there's going to be a problem. So you just get that intuition and you follow through with it. In a virtual consult, you kind of get that. But people, I think, you know, it's the due diligence. It's your face. You know, of course, the internet can give a lot of false information, and you're having to clean up from stuff. I heard this and I heard that. And then it's like, I'm educating you. It's my job. I'm not going to argue with something that they read online. And so, you know, the web is really good in a lot of ways, but in a lot of ways, it's like not our friend.
We had a question come in, and I think actually is to our next slides. I'm going to pose a question first as you talk through this. We had a question that basically was asking, how do you deal with the patient who says, no, inject me right here. She always puts it right here. She always does it right here. And the patient's telling you how to do it, or they're telling you how great their other injector is, but now they're sitting in your chair.
I won't do it. So my basic and if I don't know if you even had the opportunity to listen to my talk in Vegas, I've been very successful saying, you know, what is your concern? And they'll tell me, and they don't know where it's coming from. They don't know the anatomy and that we're losing muscle, bone, and fat and all that. Some of them don't want to be bored with listen to it, but I think you can gauge from that initial interaction with the patient and of like what they're going to be tolerant to listen to. Some of them don't want the big long spiel, but basically faces they invert as you age and everything falls. And you need to have a holistic approach. You don't want to put a Band-Aid. If I just inject you in your cheek and your temples are hollow, you're going to have a drop off cliff. It's not going to look natural. And if something's not going to look natural, I don't want my name on it. I am more than willing. I'll have patients that come in and say, you know, while I'm in the chair, let's just do everything. So I can do 6, 7 syringes and it's going to look natural. But if someone's coming to me, one of my favorite questions to ask them is like, have you ever been injected before? Sure. When was the last time? Did you just move to New York? No. Well, what brings you to see me? I like to listen and find out who dropped the ball where, because if they were happy, they shouldn't be sitting in my chair, you know, and if 3 people did it wrong, again, chances are 4th person's going to do it wrong. So I listen and I'm like, you know what? Everybody has their way of injecting. That's not my personal approach. And in Pearlman Aesthetic Surgery, I don't think I've ever seen anyone walk out looking unnatural. I think that all of us are on board, and I know Dr. Pearlman, and this is why I am forever loyal and faithful to him. He has no problem with us turning a patient away. If we're not comfortable, if something's not going to look natural, we just don't want our name on it. So if you're going to come in, you're going to sit there and draw me a map of where your other injector injected you, or ask if they can get their medical records transferred to our practice, I'm not that injector. And I'm not going to set myself up for not meeting an expectation, for failing to do what the injector did. If your other injector was so great, then stay with them, or go consult with someone else that's willing to do that. That's just not my approach. And so I have no problem saying no. I mean, I won't do it, which brings us to this slide too. Listen to their concerns. What is bothering you? Well, can I tell you what you're seeing? It probably isn't your under eyes. It's because you've lost volume in your cheek. So after I give them the opportunity and give them a mirror to point out what's bothering, we'll go through and say, you know what, but this is the underlying cause. And if your goal is just to look refreshed and renewed, we need to come up with a plan. And it's not starting with a cheek. I'm very much a believer starting from the top, work all the way bottom. Less is more. You may use less product if you're starting from the top. Our goal is to lift. And when you say that and you say less is more, and if we start doing this to try and correct the problem, we might not have to put so much filler in your lower face. They're kind of like, that makes sense. And if your budget doesn't approve it, and they're like, well, if we have one syringe, can we split it and like do a half in my temple and a half in my temple? I'll say no. I'll say, you know what? Why don't you wait? And when your budget allows it, because I am not going to give you a sub-ultimate result, because they might, well, you can do, and I hate to say this, but we're being candid and honest, and most of us here are providers. You can be the biggest cheerleader and be like, look at my work. You look so beautiful. Look in the mirror. Oh my God, you look, they're going to walk out and their friend's going to say, did you do something? Like, I don't see anything different. Or they're going to go home and get in their mirror and be like, I just spent $1,000 and I don't see a difference. So you're doing them a disservice. They're going to think it was your injection method, but you're upfront and honest and be like, you know, I'm doing the best thing ethically for you. If you're not going to see the difference, then let's just wait and do it the right way. I'm not going to pressure in someone and take that one sale and be like, oh yeah, I sold a syringe. I mean, that's not the reason we do what we do. And if you talk to Lori Robertson and you talk to George, or for me and all these high level, Connie Brennan, they all are on the same page. Why do a disservice to your patient? Our goal is for them to be happy and not go anywhere else, and stress that we do it the right way. You're not going to be in here every 3 months. You're not going to, like, let's approach and come up with a semi-yearly plan, you know, come up with a yearly plan and keep you looking the best you can, age appropriately. And because I think sometimes that money scares them. You're like, if we're doing all this, you've done nothing. We're starting from scratch. You're not going to have to invest this all the time. And if it's someone who needs it, let's talk about surgical options. You know, so many approaches to it, but I'm not a one syringe girl, and I'm not having a patient dictate to me what they want done.
Well, it's interesting. I'm obviously a patient. Over the course of many years, I have gone to many different people, and it always makes me crazy when someone says, well, where do they usually inject you? I'm like, I don't know. Aren't you the expert in injecting? Do you need me to tell you how to inject me, or do you know how to inject me? I think a lot of times injectors they open that door when they ask a patient. So my recommendation as a patient in your chair, never ask me where the person before you put it. I don't know. I don't want to know. That's why I'm coming to you. So I hear it, obviously having been in lots of clinics, doing lots of trainings, I've heard lots of people ask, well, how do you normally get that result with your Botox or Dysport or Jeuveau? Oh, well, she does it here, here, and here. Well, you've already showed the patient you're not the expert and they are, and you lose credibility. So don't ask that question.
And another thing too that it's like a pet peeve of mine is I'll have a patient that's been seeing me. Like I said, I've been in my practice now for almost 5 years, and I'll have someone that hasn't come back in 2 and said, you did the most amazing job. Do you have my chart? I want you to do what you did last time to me. I'm like, honey, that was 2 years ago. What I did to you 2 years ago does not necessarily mean that's what's going to be best for you today. So the only thing I like to ask patients is, were you injected before? Okay, what areas did you have treated? And how was the experience? What didn't you like about it? If they're like, oh, I felt like a brick was sitting here, well, chances are they didn't have their glabella injected. So I'll educate off of that. I want to hear, like, if you're in my chair, who dropped the ball and why? What didn't you like? And make sure that you say, okay, this is your choice. If you want to do your forehead and you don't want to do glabella, I'm not trying to upsell you, but you might feel like a brick is sitting on your forehead. Come back and let me fix it. I don't want someone walking away complaining, saying, oh, I went to this nurse injector, Heather, and I couldn't move my eyebrows and everything like that. I'm like, no, I always say, give it 2 weeks. You choose to come here, and I want you to be 100% happy. If you're not, give us the opportunity to fix it. So, but pull up your chart. What did you do? I want you to do the repeat treatment. I can get an idea of kind of what we did, but that's not going to dictate what I'm going to do that day. And I just make sure that, you know, things have changed in 2 years.
I've aged a lot in 2 years. I promise you.
They-
Would not be
Oh,
applicable.
yeah.
So you're a big educator, and I love the word, we call it at AR, edutainment. We want to entertain you and educate you so you're compelled to keep listening. So walk us through your education. What are some of the words that you say, the things that you use to educate patients?
Basically, we kind of touched upon it, but I like to look like a global approach. People like to look, and I actually, Dr. Pearlman, and I didn't realize, but he had said, you know, what you see in your photographic view and your reflective view is not the same. And when people look at themselves, they're looking in a mirror straight on. They're not looking at a 3D dimension. They don't realize, you know, you have pre-jowl sulcus, like you've lost definition in your jawline. So I like to have them tell me first, what's the problem? And then, you know, of course, and I'm very much, you know, if you are 30 and I'm talking baseline, never done anything, chances are you probably need 3 syringes. If you're 40, you might need 4. I make sure that they know it's a 1/5 of a teaspoon as a syringe. The lumen, it looks like a lot and it's pricey. So it sounds like a lot, but it's not. So after they go through and they show me, oh, this is what's bothering me, this is what's bothering me, my under eye hollowing. And I'm like, well, look, you know, you've lost this. And I have them turn their face, you know, or that's when I'll go and incorporate a photo and say, you know, and I love it. Patients are like, I don't want to see my picture. I don't want to see, like, it's horrible. I don't want to see it. But I think it's really important that they realize, like, you've lost your contouring in your cheek. You've lost the contour in your jaw. You don't want to have these stuck out cheeks and have everything in hollow, which I love how everybody's getting to do more contouring with cannulas and doing areas that were so much on periosteum to like get a nice, well-rounded contour. And so doing the global approach has been able to meet multiple syringes. And I mean, even so much as like Lori Robertson had told me when patients come in to do pictures, she hasn't put their hands up. And people go, why? Well, we're addressing your face and one day your hands might not match your face. And if you ever decide that you want to do something with them, then we'll have the opportunity to do that. They're like, oh, you can do hands? There are a lot of things that we can do with faces that patients just aren't aware of. So building that long-term plan better than the short-term, we can do this, or you're new to this, let's start you with a toxin, see what you think, we'll have you come back. They're so excited, what else can you do? And then saying no. But I mean, going and helping them maximize their budget, putting it where you're gonna get the biggest bang for the buck. I'm more of an injector, and I know, like, I think we can talk off label on this, can't we?
Oh yeah.
Okay, so like using toxin for perioral lines, I like better than using a filler for the most part, because I just think it relaxes it and you don't get that displacement of product and that spongy look up there. So that's something that's not going to cost the patient a lot of money, but it's going to make a significant difference. So let's do your lips, put a little bit of toxin up here. You know, let's, you know, for pre-jowl sulcus, let's go ahead and inject your DAO. Let's see what kind of lift we can get with your oral commissures from your pre-jowl sulcus, and then we can do the bands. So I like to find the little thing that's not going to cost them a lot of money so that they can incorporate using their money into doing the stuff that we need to approach with filler. So I like to mix the toxins. And you and I had talked about this last week, and I really agree with it too, is I think when patients come back, I think budget, of course, is a concern, but I think the patients that were putting money into this are still going to do it. They have been at home wanting, you know, these procedures done for a long time. I think it's going to be our best interest to maximize every tool we have in our toolbox, not just doing that one thing and coming up with a longer plan and mixing modalities. I think that that's going to be giving them the best result, getting a good revenue for us, get them back because the toxin's going to last, and then maybe approach a filler in that area. I think there's lots of different ways we're going to be able to approach these patients based on what they're giving us in that basic conversation. I think we're going to have to be like kind of psychologists.
Well, I think that's part of education now too. I think scarcity is an educational piece right now of, if you want these things done, and you don't get them done today, obviously a less harsh tone, I may not be able to see you for another 6 months. I have no idea how backed up you are. I'm sure you're going to be backed up for quite some time. I think there's an educational piece of the patient of, you're seeing that everything around us is now a little bit different, and my schedule is very full, and I want to make sure you get what you need while I'm able to give it to you. We need to think about how to get all that done today.
Absolutely. And prior to this, we had discussed that. I have been making a list of patients that have DM'd me. They're like, it's almost crisis mode. It's kind of like me with my eyelashes. I'm like, oh my, when are you going to open? I want to make sure that I get your first appointment. Like my hair. People are really, really wanting to get back in, and they're really wanting this done. And I know in our practice from the discussions that we've had, our appointment times are going to be lengthened. We're going to have cleaning. We don't want people in our waiting room, stacked on top of each other. I think being on time is going to be huge. But I think, and I hate to use this word, but I just think it's the one I can use that's going to like get my point across the most, is almost creating that sense of urgency. Like, you have all my time and attention right now. We contacted you. You wanted to be on our list. I don't know, like you said, when we're going to be able to see you back again. But I think that the time of year that this happened is really good for us. I know before we closed, our practice was like so busy with injectable patients. And I know Dr. Pearlman has been slammed with surgery. I just have seen the trend over actually the 10 years that I've been injecting that, February, March, and April, everybody's like, I'm going away. I want to get my stuff done for summer. And then we get that little lull. I think we're still going to have that slam. It's going to come a little bit later. Vacations are going to be postponed. People are going to want to get this stuff done. I think we'll stay busy to get us through, which typically are our slower months. And I think in the fall, when all this is behind us, God willing, we don't have a rebound from this, people will get back on their regular schedules. I just think we have an opportunity to increase numbers in our practice because, like I said, unfortunately, a lot of practices are not going to survive this.
I'm going to put you on the spot so hardcore right now. And this question comes up on every webinar we have with a provider on it. And you can tell us, I want to disclaim for the audience, whatever Heather's answer is, doesn't have to be your answer. This is just going to be her answer. So when we come back, will you be doing dermal filler lower face or dermal filler period?
Okay. So I have had this discussion with many of my colleagues on many webinars, and a lot of colleagues that I look up to and respect. We have different opinions of this. Ultimately, I can pass the buck on this one. And I don't know if Dr. Pearlman is still on here and if he wants to weigh in. We had the discussion. We are going to be screening our patients. I think that the consent form is going to be huge. Personally, I'm not the boss. I will do whatever Dr. Pearlman's comfortable with, but I absolutely am comfortable with it, because just because you're testing negative today doesn't mean you're not going to get it. So we don't have a crystal ball. If we're doing due diligence and doing full screening, and if you've been around anybody that's sick, if you've been around anybody, of course, we're going to be more vigilant with our immunocompromised patients. And I'm going to do a really careful screening. And I think having that conversation with people, there is a chance. I can personally tell you, we can talk off label. I am going to stay away from probably a lot of Vicross technologies, stuff that has historically on occasion had late onset nodules. I don't know that I'm comfortable with that. Somebody even has a sniffle, I'll probably be like, even you don't have an elevated temp, I'm gonna be more careful. But I don't have a problem with doing both. I'd rather get in and meet everybody's needs. And we don't know when the end of this is gonna happen. Like, we don't. And I know, like, for me, I'm like, oh, it's time for my dermal filler. And I honestly fear that if patients are told no, they will go somewhere else. They may get a suboptimal result, but I do think that you may risk, losing that patient. I think pre-screening is going to be huge. And I think using common sense and proper cleansing technique, changing your gloves, using HIPAA, just being hyper vigilant about that, I personally don't see a problem with it.
Well, I have, from the man himself, Dr. Pearlman, I have his response here. He says, we're pre-screening all patients to back up what you're saying. You'll wear N95 masks and full face shields, looking into sprays and mouthwashes that can help reduce virus count and hypochlorous acid. So if it gets in the eyes or nose, mouth, whatever, it's going to be okay. So I think there's some extreme PPE precautions that we have to all be taking. People are asking about, is it selective? Is it perioral injections, toxin or filler, whatever? I think it's a case-by-case basis. Certainly ask your medical director. But you make a great point that you need to have a COVID-19 consent form in your practice. So tomorrow's webinar, Victoria and I will go all through the no-touch protocols for AR. But that COVID-19 consent, if I'm a provider right now, is a mission critical. I don't care if you have Lysol in your practice if you don't have a consent. You have to have that done.
Yeah,
because to
exactly.
your point, saying that this is not required, this is not a necessity for you to survive, you're choosing it. And because you're choosing it, there comes with the inherent risks. And you gotta sign it or you can't get treated.
And you do. And how many times do you have people like, I'm very big on, if someone comes in, especially like around flu season, and I'll ask people, have you recently had a flu shot? Have you recently had, I want to cover myself to make sure that if for some reason they get Botox and they had a flu shot yesterday, and all of a sudden they get an adverse event from the flu shot, that they can't blame the Botox. I'm really, really careful that I ask about dental procedures, but you know what? How many people, I've had patients look at me and go, you know what, I have this, but if I mark that I don't, is it okay? I mean, patients are going to tell you what they want to tell you. So you go with your gut and you cover yourself and you educate and you do your due diligence, being the best provider that you can. And what else can we do? And I know that has been a big topic for discussion, but I do feel that patients that want their lip done, if they get told you're not going to get them done and they haven't been around anybody, it's like, I do think that you potentially can lose that patient. They probably will be back, but I see that, just going forward, that could be a potential issue.
Dr. Pearlman mentioned in his little chat in about face shields, and someone said, how are we going to do things with people wearing a mask? I think if you have on a face shield, the patient takes off their mask to inject, that's a much different scenario than if you're not shielded up.
Exactly. Yes, the safety of us. And I know we're fortunate. We have a brand new, beautiful building and we have a couple waiting rooms. So I know when we go back, our big thing is going to be telling patients they need to be on time. They cannot bring a family member or a friend or anyone into the practice with them. We don't want people stacked up in the waiting room. We're going to stagger them. And whatever our office protocol is, we're going to follow it. But I know that these past 8 weeks, everybody has been working as a team to figure out how we're best safely, proficiently do what's best for the staff and our patients. And I think it's great. These webinars I've taken, I'm doing another one on rheology next week for Galderma.
Ooh, my favorite topic.
A lot of, it's going to be my first rheology one, but I'm excited about it. I love it. But a lot of people have done due diligence and watched these webinars and and I think everybody's on the same page. And I think that's going to be really important going forward, because what we do in practice is people are going to hear, oh, well, they're doing this. I think that's the one thing that's kind of been a setback, is we haven't been uniform in the United States. So some places are open, some are not. New York, unfortunately, we got hit the hardest. I don't know what's going to happen there. But I know, like with this launch of KISS, I don't know how they're going to distribute that, because I know they want it all to be on an even playing ground and who gets it first. So we're doing, the train the trainers and stuff in these past couple weeks, but everybody's going to be really excited to try that product.
I have not had my lips done in months and months and months waiting for KISS. So
I have KISS in mine. I was lucky.
I know, I need it. I've had a lot of define in there. Not any KISS. Okay, so you and I talked about this at length last week about just say no to post-COVID sales. And I think as we go into this slide, what we've all just talked about with face masks and PPE and procedures and all these things you're going to have to do to then undercut your margin even more when you have a waiting demand, and the supply is getting more and more limited of people actually doing this. The economics of that makes zero sense to me. If we have plenty of people who want it, it's taking us more time and money to do it. Why would we give people a discount? It's not logical for me, but I am talking about it.
I agree. I'm completely anti-sale at this point. I have worked in, you know, a small practice here in Charlotte, and then a medical spa here. I have lots of colleagues that own their own places, and I hear people saying, we're going to do packages and offer discounts. And I don't want our patients feeling like we're desperate for their business. I think that our office has put so much into having a state-of-the-art building, and we work with the best of the best, and our employees are great. Like, why discount that? I'll go into some trainings, and I had a nurse who's like, you're a high level injector. You use all these syringes. How do you do it? And I looked at her, I go, honey, your Chanel shoes are beautiful. Do you think the girl behind the counter felt bad taking your $900 for your shoes? This is a facial aesthetic practice. This isn't Walmart. You are walking into a practice where you want the best done for your face. Why are you going to discount that? I can see a couple times a year incentivizing or saying thank you for being a local patient, but there are a lot of reward programs that Aspire does, and we do with Brilliant Distinctions that incentivize patients, and it's on them to keep track of the rewards. But for the quality that you're getting, you pay for quality. And I think when we get back and people start discounting all these services, I think it's going to hurt the industry as a whole. I don't see a reason for that. These people want to come in. I know, and I will say it, it's terrible. We're just opening, but I was so desperate to get my hair cut. And one of the nurses that I know that went back to school, she had been like quarantined and stuff. I begged her. I'm like, honey, come to my house. My boys need it. My husband needs it. I'm like, I will pay you $200 extra. Come to my house and give us all haircuts. People are desperate to want to get in and want our services. And they're not only going to be getting our services, they're going to be getting extra time, attention, cleanliness. They're going to be getting what they pay for. And that's why it's important, people know you chose to come to us. It's our job to not only meet your expectation, but to exceed it. And when you're giving that level of quality, I don't think it should be discounted.
We got people raising their hands. I put this, based on what you'd given me, I kind of put this deck together, and I put this in here, which may not make any sense, but the price shoppers don't care about relationships. And what you've told us the whole time is it's about relationships and investing in your patient and educating and explaining and spending time with them. When that bargain basement Betty comes in, that's not what she cares about. So if you do all that effort and then she's just here shopping your Botox prices, I feel like it's like a double whammy of a waste. Like, eliminate your price shoppers. Just get rid of them.
And that's the thing. It is. And you can, that's why I'm hoping, like I said, we have been, trying through this past couple months to keep in contact with our patients. We have our patients that have been at Dr. Pearlman's office. God, I've been there 5 years. They've been there since he opened. There are loyal patients. We want them to come back. We're not going to sit there and say, oh, well, you're our favorite, we're going to take you first. But we are certainly going to give priority to these people who have been saying, can I come in? We had to cancel their appointments. We'll take new patients. But I think getting going, we're going to have to allot some extra time for our loyal patients. And I think when people come in and they call and they're like, oh, are you going to have a sale? Being told straight up in the front, I'm sorry, we don't do discounts. We actually have a wait list right now. I think is going to alleviate a lot of that, because the last thing I want is, for us to go, and I want to treat everybody. I don't think one patient that just comes in for a neurotoxin, I look at everyone as an opportunity to turn on, to upsell, and to do a different area. I'm certainly not going to turn anybody away like that, but that's not going to be given my priority to get them through the door, where I'm going to have to take 45 minutes of my time. I work with Dr. Pearlman 3 days a week. When we come back on, I'm going to give 4 to 5 days a week to try and get all of our patients taken care of. And I know between his surgeries and him working, we have a lot of treatment rooms. We're fortunate that I think the both of us are going to stay so busy. It makes it a little easier with a pre-existing patient because you know what they're wanting. I just think they're going to give it to me all, not like, okay, I'm coming in, but I'll be back in 3 months for my lips. I think they're going to be like, I need it all right now. And I think that's going to take a lot of our time.
Someone had a great little quote. They said, bad Botox is never cheap, and good Botox, something. It just went away. It was on here. It was so cute.
What, it costs more money to get it fixed?
Well, it was like bad Botox is never cheap and good Botox is never bad. Or anyway, point being, it was super cute, but it was about the fact that if you want good work done, it's going to cost you. And someone just said in here, asked if they want me to take discounted training, discounted, you know, if you want me to give you a discount, I'll give you a discounted experience. Which
bad Botox is never good, and good Botox, I can't see it all. It's from Victoria Adrian.
Yeah, bad Botox
see it all on there.
Botox is never cheap. That's what it is.
Yeah, there you go. And then I love it. Someone says, you know what? If you think you're saving money getting cheap Botox, wait until you have to pay 3 times the amount to try and get it corrected.
You get your brow to come back up.
Yeah, it's true. And I guess, like I said, this all comes easy to me because I love it and I love patience and whatever. But I think just like building relationships. I mean, who wants to go in? Maybe there are some people that want to go in, they sit in their chair and I want this. It's like a boring appointment. I love when my patients come in and they're excited. They're like, oh my God, I haven't seen you in 3 months. Fix this. You know, it's like friendly, and they like bring food, which, oh my God, I hope nobody brings food when we get back. I mean, like seriously, everybody's got like their COVID-19 19 pounds. But I love when people come in and they're excited to be there, or they'll stop people in the hall and everybody's approachable. They said, I'm excited because I think we're going to have a fresh platform to grow on. So I'm trying to focus on the positives and, you know, and not the negatives, but it's definitely going to be a challenge.
Well, I think I had a call with a few doctors yesterday talking about, you know, their protocols and getting staff on board, and, you know, that it's a challenge to get people who are inherently already scared to come back to work to like really buy in. I know that, you know, I've talked about that. You get a much different opinion, as do I, but I think this idea of like safety and trust for patients, like if you can compel a patient that, you know, you can trust us, we're doing all these things, it's safe, effective, whatever, you know, the product itself, plus what we're doing with you, PPE, all that, people will pay more if they trust you. Because right now people are scared in general. And if they trust that you're doing the right thing, that discount is the least thing in their mind. It's like, do you want to be sick or do you want to pay for a discount? Not that that's real life, but you get the point. Extreme.
No, I agree. That's a great point. I do think, I know there are going to be some that are very apprehensive, and I think they wouldn't go in for a treatment if they weren't coming in to see Dr. Fee or myself, because they have that relationship, and they trust that if we didn't think it was a safe environment, we wouldn't open. And I know there's going to be some that just don't care. But I mean, for those, especially the older ones, the ones that are, you know, they're apprehensive. Like, I know I've been coming here forever, but I'm nervous. I think putting them at ease, it's going to be a little harder for us to try and do that, but they wouldn't be coming back if they didn't trust us. So, you know, I'm pretty proud of that. We have New Yorkers, I will tell you, they are tough as nails, but I say they come in like lions and leave like kittens. Once they trust you, they are so darn loyal. So loyal. I mean, I've had patients in Charlotte give me a harder time than I have working on Park Avenue. I always thought, what am I going to do? Like, who thinks that's an easy job? Injecting Botox on Park Avenue. Some of our patients are amazing. I'm like, we just have the greatest people. And I miss the city. I'm kind of afraid to see what it's going to be like going back right now. I'm sure it's eerie, but I am excited to get back.
As I'm sure many of your patients are ready to get back too.
Oh yeah.
We kind of touched on all this too, that, you know, it's going to be a different psyche. They're going to have to your point, maybe warm up a little bit longer than normal. And I think too, there's going to be some, you know, as you think about selling and converting, people are like, I can't do it. No, like not losing faith and being discouraged that it may be very different in some parts of the country where there's been a high unemployment rate. It might be extremely different what they're able to spend now versus even 3 months ago. So.
Yeah, but I do think that there's going to be, like, we're getting into the summer season. So that aspect of, I think, practices is going to be a little bit of a disadvantage. We're going to be unable to do a lot of laser procedures just because of the sun. But I do think it's going to be a good time for people to really vamp up like their skincare sales, because people will be, what can I do? You know, microneedling, getting on good skincare. I think we're going to be able to sell a ton of sunscreen. Get them on plans and say, here's the deal. We kind of started late. Normally you would have gotten your laser treatment, you know, now the sun is out, but I think it's a good potential to say, you know what, even if we're saying, you know, we're not at this time doing this laser procedure just because it's summer now, but we are starting a list for fall. I think that might be a good thing too, to start people going, wow, nobody's getting lasers right now, but there's going to be a list. I want my laser treatment. I know I need to be on my skincare to get us even busier in the fall. I think getting patients now to pre-book their appointments, and I think treatment plans are going to be more important, especially because no one knows what's going to happen in the fall. If we have to stay on a reduced schedule and appointment times are going to be longer, people are going to be like, oh hell, it's be like, I had my one chance to get my hair cut and I missed it. If I'm not going to have Botox and I have to get through the holidays, I'm getting on that schedule. So I think that it's going to be a good time to go ahead and have people secure their appointments ahead of time, like we haven't seen before.
I think I've been using this roller coaster analogy since this thing started. It's going to be like this because we don't know if we're going to get locked down again, if there's going to be more outbreaks, if the government's going to come in and intervene. People are out of money. We have no idea. Everything's so unknown that it's like carpe diem every day. You have to like maximize every chance, both for the patient and for the provider, because to your point, we don't know. We just don't know. So I think we have to dig in right now and like maximize every interaction that we have all the time.
Yep, I absolutely agree. And that's why I'm like, and especially and I don't know how we're going to do it. Like I said, I don't make those decisions in our office, but trying to spread out patients that are going to get multiple modalities, people that are going to come in, get their dermal fillers, get their toxins, utilize that time, because, you know, your toxin patients are going to be, you know, you'll be able to get them in and out a little bit, you know, quicker than you were the other ones. But I'd rather see a day filled up that's very productive than to have to go and just like do Botox. Okay, maybe a syringe filler, because I know there's those patients that are coming back, and I've had patients say, I need everything. I've gotten like these selfies, like, look what happened. And I'm thinking in my head though, I'm thinking, okay, we've been closed down for like a couple months. So maybe your Botox is wearing off. It's been a year since your filler. It's probably time to do it all. But a lot of those patients were seen right before we closed. So now we have those patients that were due, you know, that are coming due now, but the ones that should have been done 3 months ago. So I think we're going to get double whammied.
I think your idea of a treatment plan is really helpful, because I think if those of you who lived through as a business owner or working in the industry, 2001, 2008, we saw this, you know, it seemed okay. And then the bottom fell out, but it was months into the crisis. So I think we don't know if we're going to have this kind of roller coaster financial life after this. So I think take advantage of it now and also book them in for, to your point, long-term.
Yeah. We need to stay on the curve of that roller coaster.
I'm sorry.
We need to ride that roller coaster wave, because we really don't know, and it's preventative. So I think that, you know, as much as everybody's apprehensive about opening, that's why I'm sitting there and I hear people talking about sales and it makes me cringe. I'm like, why would you do that? It just makes no sense to me, because people are going to want to come get everything done. We've had months of lost revenue. We're going into the slow months of the summer, and all it does is it's going to drive everybody else's prices down. So I think just believing in your product and quality, and if people go somewhere else because they're getting a discount, they'll be back. But I don't anticipate that happening. I'm in the room and I am the one that actually, you know, the physicians have someone, and, you know, physicians, they don't get into the financial aspect of it. I am doing my own consults and I'm actually having to discuss prices with them. And I'll tell you, it's not very often that I'll have somebody try and barter a price with me. I just say it with confidence. You need 1-in-1, and it's, you know, it's going to be $1,000 a cheek, you know, $1,000 temple. So we're looking at like 4, but it's going to get you through a year. I take myself out of their back wallet and I present like the Chanel shoes, the Christian Louboutins. This is what you want. You know, it's $1,000. I don't go, well, I know it's going to sound like a lot. And I used to do that. The Southern side of me was like trying to protect their money. Like, oh, someone told me it was going to be that much, it would kill me. And I just say it and they're like, okay, that doesn't sound unreasonable. I'm thinking, wow. And when I changed that,
like, damn, I should offer 6,000. No, I'm kidding. I'm kidding.
No, but when I changed that, it's not like I'm being dishonest. I'm like, this is what you need. This is what it costs. Let's come up with a plan to meet your need. It's not like I'm dishonest. Me, I'm being honest. If I can get away with less, I'm like, you know what? I'm telling you 5. Maybe you only need 4. You know, and that's great. But I'd rather get in there and say, oh, for another $1,000, we could have really done a good job. I mean, that to me is dishonest. So it haven't really, and I do realize, you know, we're in Manhattan, it's a little bit different. It's not the same all over the country, but their prices are less. But if you're comparing apples to apples, I truly think it's the approach that you take with that patient.
Okay, we have two last questions, one of which I can answer quickly. Someone asked, how do you get licensed in other states? If you are an RN, you can get a compact license. If you're in a compact state, go to NURYS nurses, NURYS.com, and you can see all the compact states and how that works. That's how you have 26. I'm sure, Heather, you have a compact license.
And I will say that when you go on that site right now, I believe there are like 7 or 8 floating states that are interim right now trying to get in the compact licensure. I know for a fact New York State and New Jersey required, and California require their own.
Yes.
Those are the 3 I know right off the top of my head.
So NURSYS nurses.com. So that's one way. And then the second question was, walk us through just briefly all the PPE that you're going to be wearing.
That's still to be decided. We're still waiting to hear from Dr. Pearlman. I know that he has spent multiple hours on webinars with all of his colleagues. I know we're going to have N95 masks. Of course, we'll be wearing gloves. I don't know about face shields yet. I don't know about hairnets. I don't know about gowns. We're kind of just going through seeing what everybody's doing, industry standard, what's going to be safest for our patients, which supplies we're able to get. I know we're going to want our patients to wear masks. Of course, that's not going to be feasible in the room, but the staff will be protected. But like I said, we're still working that out. We don't have an official open date yet, but I trust when we get that, all that will be into place.
He did say on the chat about face masks for lower face toxin or any injections lower face. So I think face mask, I've heard that the past couple of days from several physicians, medical directors saying face mask if we're going to be doing filler. People sneeze and, things happen when you start injecting. Even my bunny lines are always a mess for me. So,
Yeah, I mean, and I know Dr. Pearlman, I believe I'm correct in saying this, said N95 masks for staff, not necessarily the patients, because it's just to protect us. So we'll have the N95 mask and probably just generic masks for the patients, mostly for when they're in the waiting room coming in and out of the office. But like, as I've said, it's not going to be feasible for them to do that while we're injecting them, but there will be some protection there.
Well, I think we are over our time. I could keep going with you all day long, but
I know this was fun. Thank you so much for having me. I wish everybody luck and everybody stays safe and healthy. And Tiffany's going to put up my Instagram, I think, on here.
Yes, our next slide.
Record.
She's a great Instagram.
And I'm going to do one shout out for Aesthetic Record. I have had a couple people DM me about technologies and Aesthetic Record. We had already purchased one for our office. I have heard nothing but wonderful things, and Tiffany did not have me say this, but I have been in Jubilee with Dr. Harper and seen the technology. So I can't remember. I know one of you said you were going to be joining us today on this chat. If you have any questions about that, contact her, but you won't be disappointed. I know a lot of people are moving over to using that system, and I have heard nothing negative. I've heard wonderful things about it.
Well, I appreciate that. We did not pay her to say that. I promise.
You did. I just did that as a throughout because I believe it.
Well, join us tomorrow for a whole post-COVID no-touch kit that launches, so you can be hands-free with patients when they come in from check-in to check-out, so you can just focus on injecting. But we are so grateful you came, Heather. I know you do a great job. And go follow Heather. When you come back online, let us know and give us updates of what's happening in New York and how things are working. And if you add new protocols and procedures, I'm sure we all would love to know that. So keep us.
Okay, and I look forward to seeing you soon. And for all of you that joined, thank you very much for your time. I hope that you got some helpful pearls or insight from me. But if not, I hope everybody had a great time.
Well, we will see you in September at Aesthetic Next for sure.
We will see you then. Okay, Tiffany, I'll talk to you later.
Bye, guys. Bye-bye. Thanks for coming.